Welcome to Medical Logistics 101 Dizziness Overview. This video is for educational purposes only. It is not medical advice, does not replace a medical evaluation, and may not apply to your situation. If you have symptoms or concerns, please speak with a licensed healthcare professional. My goal is to help patients enter healthcare with a map instead of a blindfold, and to explain how clinicians think through these problems in resource-limited settings. Dizziness. Definition. Dizziness is an umbrella term patients use for several different sensations, such as feeling faint or lightheaded, feeling off balance or unsteady, feeling like the room is spinning. I like to think of them in two categories, primary dizziness and secondary dizziness. Primary dizziness, problems originating from the vestibular system itself. These tend to be sudden, affected by position, reproducible on exam, often associated with nystagmus, which is a rapid and repetitive movement of one or both eyes. Examples of primary dizziness: BPPV, which stands for benign paroxysmal positional vertigo, vestibular neuritis, labyrinthitis, and Meniere's disease. Secondary dizziness, dizziness caused by systemic or whole body issues, not the inner ear. Examples would be anemia, dehydration with electrolyte abnormalities, hypotension, and you can see orthostatic changes with that. We'll discuss that in a minute. Arrhythmias, of course, infection, medication effects, and if there's a history of diabetes, perhaps hypoglycemia. Signs, symptoms, important questions. Do you feel like you're going to pass out, or is the room spinning? Does it happen when you turn your head or roll over in bed? Is it constant or does it come and go? Are there any hearing changes, such as ringing or fullness in your ears? Any vomiting or diarrhea? Any history of dark stools or heavy menses? Any recent illness or fever? Any new medications? Exam for primary dizziness causes: is nystagmus present? What direction do the eyes move with that? Another simple quick test we do, Dick's Hallpike maneuver. You can look that up on YouTube. Very easy to follow. Used to diagnose BPPV. Head impulse test, another test we sometimes use for dizziness exams. Gait testing, and of course an ear exam. We want to make certain that their ear canals are patent and you don't have a cerumen impaction in one or both ears. Secondary dizziness exam. I always get orthostatic vitals, their blood pressure and heart rate, lying, sitting, standing. Is there a change in that with a change in position? Physical exam, of course, including a good neurologic exam. I always get an EKG in these patients just because there could be an underlying arrhythmia they're not aware of. Look for signs of infection. Look for signs of dehydration. Look for signs of anemia, pallor, or tachycardia. As I mentioned earlier with the dark stools or heavy menses, oftentimes when I'm talking to patients, of course, I have my stethoscope around my neck and it's black in color, and I'll ask them, I said, does your stools look the color of my stethoscope, or are they tarry in color? We call that melena. And as far as the menses, oftentimes when you see a young girl and if she's pale on exam, I'll ask about the history of her menses, and if she gives me a history of very heavy menses, when you check a hemoglobin, you'll find it's very low. Oftentimes it may have been low for quite some time. It just reached a point where she's finally having symptoms such as dizziness with it. Diagnostic studies, primary. Usually no imaging unless red flags are present. Dick's Hallpike test is diagnostic for BPPV and can be done quickly in the room. I would sometimes consider an audiogram if there's hearing symptoms and you don't find anything major on the exam of the ear, such as cerumen impaction. Consider MRI if there's atypical nystagmus or central signs, which would be concerning for stroke. Diagnostic studies continued. Secondary test I generally will always do. CBC, looking for anemia or signs of infection. A complete metabolic panel, CMP, looking at electrolytes and dehydration. As I said, I always get an EKG. Sometimes I'll get a troponin if they give me a history of chest discomfort at home. Pregnancy test, of course, if indicated. And consider the CT and MRI if there are neurologic concerns. Differential diagnosis and mimics. Strokes. One type of stroke is what's called a posterior circulation stroke. It can certainly affect balance. It can also have visual side effects as well. If the symptoms are just not lining up with vertigo types presentation and they're having other symptoms that are atypical, certainly one to keep in your mind. Arrhythmias, anemia, dehydration, orthostatic hypotension, hypoglycemia, medication side effects, particularly blood pressure medications. Vestibular migraine can produce these symptoms, and of course our other vestibular causes that we mentioned earlier. Red flags: new neurologic deficits, A severe headache, if they give you the history of this is the worst headache of my life, think subarachnoid hemorrhage. Difficulty walking, changes in their gait, vertical nystagmus is a red flag. Cardiac symptoms such as chest pain or palpitations. If they give you a history of syncope, I passed out at home, that's a major red flag for me. Fever or history of volume loss, such as vomiting or diarrhea. Anticoagulated patients with sudden dizziness. We see a lot of anticoagulation in our older patients. Pitfalls. Labeling all dizziness vertigo. Missing orthostatic hypotension. You always want to check those orthostatic vitals. Missing an anemia, which is certainly the reason we do a CBC. Not doing the Dix-Hallpike test. It doesn't take very long to do it, and it gives you some important information. Missing new cardiac causes, such as arrhythmias, that the patient may not even be aware that they have. Not asking about new medications, especially blood pressure meds. Disposition usually can go home with close follow-up if it's thought to be just B, PPV, or mild dehydration, mild anemia, or no active bleeding. Caution on that if they're anticoagulated. A viral illness. Medication side effects are identified and addressed. Admit if there's central signs, arrhythmias, severe anemia, especially if anticoagulated, severe dehydration, syncope history, chest pain, neurologic deficits, any sort of altered gait or fall risk. In closing, if this is the kind of content you find helpful, please like and subscribe. If there are topics you would like to see covered, you can email me at medicallogistics101@gmail.com. Remember, the danger isn't always what you know, but rather what you can't afford to miss. Thank you.